All week, we're looking back on how the COVID-19 pandemic transformed our world. Tonight, we're checking in with those on the front lines of the virus, healthcare workers.
Amanda Fay showing us what has changed at local hospitals since those early cases came in 5 years ago.
Late March 2020, entering a hospital suddenly looked much different than it ever had. Screeners greeted patients at the door, taking temperatures, asking health history questions. Hand sanitizer and later masks became something not just hospital staff would use, but everyone inside the building.
I think that everyone can probably say that their lives have been changed through COVID.
In what seemed like the blink of an eye, healthcare systems, including Mercy Health and ProMedica, were forced to adapt as those early cases started coming in. Vice President of Medical Affairs for ProMedica's Metro Hospitals, Dr. Brian Kaminsky.
We even had separate areas for our waiting rooms for people who were presenting with COVID or non-COVID-like symptoms. We had installed a variety of different ways to provide negative pressure ventilation in our emergency departments and in our rooms.
At Mercy Health, Chief Clinical Officer for Toledo, Dr. James Tita, says his biggest memory of that time was the need for isolation.
We weren't even sure exactly how contagious it was, but given the fact that we didn't have any effective treatment, given the fact that it seemed to have a high mortality rate, we had to go to great lengths to make sure that we protected the staff, we protected each other, and of course protected the patients.
The need for protection came with some major challenges for health systems. Doctors Tita and Kaminsky say the fight for PPE, personal protective equipment, was on.
I mean, we were rationing masks, we were rationing gowns, we were trying to get as much equipment as we could.
Dr. Tita said that led to anxiety for healthcare workers, which became another challenge for hospital systems. It's one that is still being felt 5 years later. And Dr. Tita says it means hospitals may be less ready than needed if another pandemic were to strike.
Obviously, there was a big turnover of bedside workers, so nurses, respiratory therapists. I mean, it took a terrible toll on them. In terms of replenishing those ranks and recruitment for all healthcare systems, that continues to be a challenge.
Healthcare workers say they saw many seasons of the pandemic, beginning with support from the community. Then there became anger, resentment, mistrust.
So suddenly, you know, those heroes that we celebrated taking care of COVID initially turned into villains.
Doctors Tita and Kaminsky say we lost 1.2 million Americans during the pandemic, many of them in isolation. And those psychological, emotional, and spiritual scars remain.
At some point, I mean, we will have to deal with this, and I'm sure we are dealing with it, maybe not in the best way, but, you know, this was a history-changing, a life-changing event for all of us.
Dr. Kaminsky says a lesson learned is dealing with the supply chain shortages. He says ProMedica dusted off its COVID playbook when IV fluids became low in supply following Hurricane Helene's impact on Puerto Rico and North Carolina. Another way hospitals adapted during the pandemic was through telemedicine, which ProMedica and Mercy Health still utilize today. For WTOL 11, I'm Amanda Fay.